Hello, everyone. Welcome to this episode of Unity Through Diversity. And I'm your host, Gina and today in our live recording here, we have Kesley, right? And we already had a one episode last week and we decided to record the part two. So welcome, Kesley. How are you doing today?
Hi, thanks for having me again. I am doing well. How are you?
I can't, life couldn't be any better. I think life happens for a reason, right? And I think
Hmm.
we are here today to talk about certain things that, maybe things happen certain way for a certain reason. And we are here to kind of talk about it, bring awareness. I would not quote myself as educating people, but we have real life experience to share with other people. Now you on other end, you be professional therapist, right? Is that or counseling
Right.
therapist?
Yeah, like it's kind of therapist kind of is the overlapping
Yeah.
term where counselor is like the licensed term.
Yes. Okay. So I hit on both. So great.
Yeah.
But last week we talked about, because May was is the mental health, right? We're just leading to June right now. So I feel like this is perfectly to because we don't need to just only we not only talk about mental health in mental health awareness month. It should be a topic that we be more frequently, more comfortably talk about.
Mhm.
And then last episode we talk about the stigma, what is differences between mental health and mental illness, right? And some stigma around it. And we actually kind of went through the surface things about mental health, certain things that we did touch up a little bit of the top. This is number four or top four, right? So we're gonna actually
Mhm.
dive deep into the ADHD, right? One ADHD, what is that? PTSD, and the anxiety, right? And
Mhm.
also, what is the one thing I'm missing? Depression.
Yeah, depression.
Okay, so from the first question is actually from last episode. What are some things that actually popped into your mind after our recording? Is there anything special like popping in, like, oh, I want to add this to it, or something, because I want to make sure the last episode is fully complete. If for people interested, go check our last episode. We talk about, like, things generally, things about mental health and mental illness. Yeah.
Yeah, I definitely think it was a good introduction. I feel like there are always things that I think about after the fact because
Yeah.
it's like it's such a big topic. Like, how do you not think about, like, oh, I could have added this? Like, oh, this would have been something good to talk about. Um, but I think overall, we really did like a good job of like just introducing the idea of like mental health and stigma and how also like both sides of things, kind of like your side, my side, kind
Yes.
of
We talk
what
about
that looks like.
traditional, right? Traditional way of
Hmm.
uh heal those or treat those mental illness, and what is a holistic way, and what are the benefits ever combine those things, right? Yeah. Mhm.
Right, for sure.
So okay.
So I think
Yeah.
that's one of the biggest things you can know is like, what do I need in treatment? Do I need the holistic? Do I need traditional, or do I need both?
Yeah, yeah. And I think today's session, let's go each one of them. And you, from the professional, counseling therapist perspective of how you work with people for, let's say, ADHD, panic attack and those things. And on the holistic, how I treat it with people, come to me, in this way, people actually have both sides, right? Or maybe there
Hmm.
a third way. Plant medicine is one way, but that's holistic, so-called holistic. What depends on how much you use or how you use it. I don't know.
Right.
So let's talk about those things. So actually, I don't know where the conversation gonna go. So you guys are, come with us for a ride, okay? But our intention is always at the end of the day, you can take away one or two pieces of golden nuggets, and it's your choice to choose whether it apply to your life or just say, hey, wait a minute, let me do more research, right? But conversations start have a lot of people to have questions, start asking questions, start asking, is there any
Hmm.
other way? What is my body needs, right? So, okay, which topic do you want to start first?
Well, you mentioned ADHD first. I guess we
Yeah.
can start with that one.
Okay. Yeah, yeah, yeah.
I think ADHD is one of those things that we are hearing a lot about right now.
Yeah, yeah, yeah.
Just because there are a lot of people diagnosed with it. There's a lot of new research about like late diagnosis, especially in women, and how that's affecting like treatment and also women just in general. And so, as you mentioned before,
So
like
why?
obviously,
Like why? Hold on. Like
okay,
why now the woman has more of a diagnosis? And also is ADHD have different ADHD? Just, I don't know. Like I'm just like
no,
asking.
so our diagnostic manual is called the DSM. So it's the
Okay.
diagnostic manual, and we are in the revised version of the fifth edition of that book. So in the DSM, there are only three different like subtypes of ADHD, which is hyperactive, inattentive, or combined. And
Okay.
so that doesn't mean that the client may not struggle with some hyperactivity symptoms if they're predominantly inattentive, but it just means that that's where their predominant issues come from. So a lot of the times, going back to the question about like the difference between men and women, it
Mm-hmm.
presents itself very differently. So just because the DSM also only has three subcategories to the diagnosis, that doesn't mean there are not multiple different ways that it can present itself. And that's really what we're beginning to learn through research and through like the newest editions of the DSM and just people's experiences, because you have kind of like the kid in your mind that has ADHD, like the what society typically describes as that kid who is not able to sit still in class, getting in trouble in school because they can't sit still because they're talking, running around the classroom, can't sit still at home, just
So that's type
kind
of
of,
one, right? That's the hyper one.
yeah, that would be predominantly
Okay.
hyperactive
Yes. Then the second one
and
is in what's that?
inattentive.
What is the give me an example.
So that would be more of the concentration. So that would mean like your attention deficit is higher
Mm-hmm.
than just hyperactive. So, and then you have a combined type where it's just you have both. Like you don't really struggle with one more than the other.
Okay.
So typically, most people were classifying a lot of young boys in that typical kid who has ADHD, the kid who's running around, the kid who's getting in trouble, not doing well in school, blah, blah, blah. But now we're finding that there was also another group of people who maybe was the predominantly inattentive people who could sit still, but their brain was going like 90 to nothing. And they probably could get like good enough grades, but they weren't like really excelling in school. So they
Mm.
were probably, B's, low A's, maybe even a C every now and then, but it wasn't really like a problem. They weren't getting in trouble. They
Mm.
weren't, talking out of turn because it was all like inside in their brain because their thoughts are going so fast and their thoughts are all over the place. So this would also probably be the kid who could really focus in school if they were challenged. But if they weren't challenged, then they probably weren't
Mm.
focusing very well because this would also be the kids who were like, oh, this makes sense, like in math class. And then they're also thinking like two chapters ahead. Like their question is like, oh, well, what happens if you do this? What happens if you do that? Like, what if?
Okay,
And
it's a small question. Is that a thing that people, or which type? Maybe that's the second one. Is that this type of people that they cannot really read unless they read super loud? Like that's one of my actually my one of my volunteer here. we were talking about that, and I was like, what? Like,
Hmm.
she's like, I can't read it. I have to read it out aloud. Otherwise, it will stuck on that sentence. I'm like, I mean, because I never know it would be as a case. I was like, how
Hmm.
come you can't? So like it to me, my brains couldn't even understand it. Why? Is that something?
Yeah.
Okay.
Yeah, no, for sure. That's definitely a symptom that I see with people who have ADHD. I also see the other symptoms where they can't read well out loud, but they read really well to themselves.
So either way,
Because,
right?
yeah, because their brain is moving so quickly, like
Uh-huh.
their brain is processing the words, but their mouth can't speak the words that
Yeah.
quickly.
Okay.
So that's where it gets, that's why it's so vast, the amount of, like, the way these symptoms can present themselves. Like the symptoms are all the same,
Mm-hmm.
but how they present themselves and how we see them is something totally different.
Okay.
One of the biggest things right now that we're seeing too is a lot of emphasis on like hyperfixation, because we're learning that ADHD people can hyperfixate really well on things they're interested in,
Yes. Oh man. Yes.
which is like does not make sense
Yeah.
to the person who's like, well, I thought that meant you couldn't concentrate. Like, how does that work? And it's attention deficit. So that means there's an issue in your attention, not necessarily when we think of deficit, we think of less than,
Yeah.
but that doesn't necessarily mean, in this case, it's more of there's an issue with your attention, not necessarily there's like less than,
Mm-hmm.
like we would normally think of deficit.
So in your discovery, in your research, or in your, when you work with the clients, is it the guys, the case of you, okay? I don't know. In the
Mm-hmm.
general speaking, is it men diagnosed more or women or 50-50? What's the percentage wise?
So, as of the last research that I read, the males are more likely to be diagnosed, and their like average age of diagnosis is like 5 to 8,
Mm.
where women's average age of diagnosis is in their 30s.
Yeah, you don't really realize until later, right? Some of people, I
Mm-hmm.
don't think they are being diagnosed. They self-diagnosis. I feel like because like
Yes.
I have that.
Yeah.
And the second question is like, does people? So okay, let me rephrase this question. So first of all, why people have ADHD? Is there some genetic inheritance or like a why?
So there is a genetic component for sure. Like
Mm-hmm.
if both of your parents have ADHD, you're more likely to have ADHD.
Mm-hmm.
But there's basically that genetic component also shows itself through a biological factor. So last time we talked about all of the different factors that
Yeah.
we can normally have, whereas ADHD isn't something that you can really change. It's more of something that you're like born with. So we're finding out now that people who have ADHD and also people who have autism, like that neurodivergent spectrum, their brain is formed differently. Like, so it may not actually look differently, um, but there are different things that work differently than somebody who is neurotypical.
Mm-hmm.
So there may be um, neurons that are firing differently. There
Yeah.
may be different sources of communication. Like their brain parts still do the same thing, they just do it differently.
Mm-hmm.
And so that's where ADHD, autism, some of your intellectual disabilities, those things are going to be a little bit different than a lot of other mental health issues like PTSD, anxiety, and depression, because most of your intellectual disabilities, ADHD, autism, all of that is going to be basically from birth. It's
Mm.
just not going to be able to be diagnosed until, young child age.
Yeah. So next question is then we talk about that how you work with people have ADHD. And let's talk about like if some of them minor, right? Some of them literally, couldn't focus or that not excel in the school. Like how you work with those kids or even
Yeah,
with
so
adults, right?
right,
In the work relationship, how you work with people when they tell you, "Hey, I actually diagnosed with ADHD." So what they really mean, and how for a let's say myself, I so far I haven't been diagnosed, but I also don't have those symptoms. So I probably say I probably don't have it. So when they say I have ADHD, like to me, it should have a signal sent back as okay, I need to work with them in a different way, right? So what are some
right.
different way when you work with people who have the ADHD so we can better work with them, right? Kids and
Right.
adults. Yeah.
So I think one of the things is trying to figure out what are things they can focus on. So
Mm,
that's one thing that I try to do, especially when I'm working with kids, is I'll try to, whatever the main problem is, I'll try to like bring in to the conversation something that they're really interested in. So, for instance, like with the hyperactive kids who are struggling with behaviors, and we're saying like 4, 5, 6, 7, 8, maybe there's a thing that I will do with them where we are talking about like proper behaviors, and then instead of me just talking to them like I'm talking to you and like just educate them on like, hey, like at school we have to sit still and we have to raise our hand before we speak and we can't interrupt people. What we will do is we'll go over the classroom rules and then they will teach it to like their stuffed animal. So like
mm,
they're getting to use that imagination, but they're getting to use something that they're interested in. So it's kind of like also a little bit of show and tell because they get to bring that with them to session. And then they get to also be the person who is teaching that. So then it sinks in a different way.
mm-hmm.
And it really helps them to realize kind of, oh, like maybe this does make sense. And so with adults, I tried to do something similar. Like I try to figure out what their interests are, but also like how is this really affecting your day to day life? Like, is this something that you want to take medication for? Is this something that you feel like you need an official diagnosis for? Or is it something that you just want to, just explore your options and something to keep in the back of your mind? Um, a lot of times with adults and teenagers too, it's trying to figure out little tips and tricks that they can do to try and help make their day-to-day life easier, especially with routine. So routine and structure is something that's really helpful for, of course, all kids and teenagers, but it's also really helpful for those who are really struggling with mental health, especially ADHD. And so if we can formulate a routine, then everything just happens kind of naturally because
Mm-hmm.
what happens with a lot of people, especially inattentive type ADHD, they tend to forget a lot of things because their brain is moving so fast onto next topics.
Mm-hmm.
So they're really forgetting like they had every intention to put away their bowl after eating breakfast that morning, but they definitely forgot because then they saw something else and like got distracted to go do something else.
Mm-hmm.
And so trying to work with them and their families on giving them that grace and understanding is really helpful. Basic when the DSM-5 came out, they did away with what we called ADD, which
Mm,
was
mm-hmm.
attention deficit disorder, and then we also still had ADHD. So basically, what they did was they did away with the ADD, and then they said, okay, you can be predominantly hyperactive or predominantly inattentive. So a lot of times you'll still hear that phrase or acronym like tossed around, ADD, instead
Yeah.
of just ADHD,
ADHD.
but
Mm-hmm.
it's essentially the same thing
Mm-hmm.
as because the DSM absorbed ADD into ADHD.
Okay, so I'm just curious. So when if the kids or adults do need a medication, right? So
Mhm.
for those, let's just use those three different types. Do they all have same medication or the medication is different?
So all of the three types can be treated with any of the medications,
Mm-hmm.
but it's really dependent on the person and what's going on with them. So, for instance, if I know that I have um, a child who's really struggling with their appetite already, then I can't prescribe medication, but a lot of times the parents talk to me and they're like, "What are your thoughts on this? What do you think?" And so in that situation where the kid doesn't really eat a lot anyway, I'm not going to suggest that they try a stimulant first
Mm-hmm.
because the stimulant's going to reduce their appetite. So
Mm,
then you're going to be struggling even more to try and get them to eat.
yeah.
Um, so there's little things like that that can help in conversations with doctors to try and figure out what medication is best to try first. But sometimes people have to try a couple of different medications before they find the one that works for them, which is why a lot of people, if they're not having issues, then they don't get on the medication.
Mm-hmm. So for the medication, their purpose is what? To help them to be calm or what is medication
So,
for their brain, you know?
right. So, with kids, essentially like they want them to be able to be less hyperactive and also be able to focus and do their schoolwork. And then for adults, it's pretty much the same thing is we you want them to be able to focus so that the
So kind of slow
ADHD.
down their brain
Yes.
activity.
Hmm.
Okay. Yes. Okay.
One time I had a um I was working with this provider and we were seeing the same client and thought that uh they diagnosed the kid with psychosis, meaning that they had like hallucinations and delusions going on in their head. But like upon further inspection, it wasn't that they had hallucinations or delusions, it's just they had ADHD. Because
Mm,
a lot of times people with ADHD have multiple trains of thought going at one time. So the way the kid described it, because they're a kid, made it seem like they had voices inside their head. But it wasn't really voices, it was that they had multiple trains of thought going on at the same time.
wow. That's, I mean, if you encounter like that, I don't think that's the only case that people being diagnosed in a different, right?
Mm-hmm.
Because you would treat that
Yeah,
totally, completely differently, you know?
right. Yes, they it and like the antipsychotic medications that they could have been put on could have affected them a lot differently because they don't actually have those symptoms.
Hmm.
So it is really important that as like people whose kids are being evaluated, like make sure that you try and help the doctors to like understand and make sure that you're kind of being mindful of those
Hmm.
diagnoses before because like how can we expect kids to be able to explain this stuff when sometimes we don't understand it ourselves.
Yeah. Yeah. I have a fun question. Can you explain to me why ADHD people, not all of them, but I just discovered that some ADHD people or people who have this is actually a lot of them have ADHD. So what is that is when they drink coffee, actually it helps them to be calm because when people
Mm-hmm.
tell me they drink 3 cups of coffee, I couldn't even understand because I cannot really drink coffee. I drink coffee, I go super jiggly and I just don't like that feeling. You know, I was like, I don't need even get my energy high. Actually, I need to bring my energy down. But I was like, how can people drink 3 cups of coffee? And not until probably a couple months ago, I was talking to my boyfriend and he turned around. He's like, you know what? Actually, coffee calms me down. Or he
Yeah.
said coffee calms ADHD people down. I was like, why you never told me about that? I thought people crazy. Well, how can people drink 3 cups coffee? And then I asked the volunteer in our organization, and she said, yeah, because they can drink coffee at 4 p.m. I'm like, I cannot even touch
Hmm.
anything caffeine after 2 p.m. I will stay up. Like when I was young, like now, I mean, I don't need a coffee. I will not go even try coffee after 2 p.m. because I'm gonna stay up. Is that the
Right.
thing?
Yeah, yeah, for sure. So coffee is a stimulant, and Adderall, Vyvanse, Ritalin, these medications are all stimulants, and
Because
those are
that's what
the
they
some of the
take.
most common medications used to treat ADHD. So one of the tricks that I will use sometimes, especially with teenagers or college students, is if they have a big test coming up, they might drink more caffeine before that test, no matter like whatever that caffeine source
Mm,
may be, so that they can concentrate better during the test. Now, of course, like you don't want to consume a large amount, especially if it affects your heart rate,
yeah,
because that kind of differs across the board. So even though the caffeine is helping you focus, sometimes people with ADHD, it still affects their heart rate. So that's where you have to be careful, is because you could be ingesting all of this caffeine and it could be affecting your heart rate, and your heart rate could be getting increasingly high to unsafe level. So that's where you have to like kind of be mindful as somebody who has ADHD, because you don't want to consume too much to where it's affecting your heart. But
makes sense.
if it's a little trick you can use every now and then, on when you have something really important or a final or something like that, then it can be really helpful.
Yeah, yeah, yeah. Well, I just found out a couple months ago. I thought it's fascinating. I never thought of that. I was like, wow,
Hmm.
this is interesting, right? So, yeah, I just wanted
Yeah,
from
one
the.
of the like
Mhm.
one of the little like kind of inside jokes, I guess, in the field is the one of the ways to test if your kid has ADHD or not is just
Give them
give them a
coffee.
Mountain Dew. And if
Um,
they, because Mountain Dew has so much caffeine in it, and if they don't react, like chances are they probably do have ADHD.
I know. Then I don't. I drink like I remember years. Oh my goodness, probably 12, 14 years ago. I drink a little bit Red Bull too. The energy drink.
Yeah.
It was so bad I couldn't fall asleep because I have jet lag. I travel and I need to drive, so I had a little bit. It was so ever since then I never had any energy drink because I just
Hmm.
couldn't take that. So I probably don't have it in this way then. So good to know. Yeah,
Yes.
simple way to know. Okay, so I want to kind of very quickly touch on like again like those are a lot of scientific a lot of things. That's why I ask a lot of simple questions that a lot of people probably never got a chance to talk to, right? We would
Right.
because if you don't have a ADHD child, you're probably not gonna have a lot of information to process. If you don't have a ADHD husband or boyfriend, you're probably not gonna even know what's going on, stuff like that. So and in our holistic way, actually, a lot of time with ADHD, with my clients went through is actually sound healing is really help them
Hmm.
because it's well, sound bath could too, but I'm talking about a different approach of the sound healing. Especially different frequency. You talk about brainwave, right? So there a lot of times I think if you shift your brainwave a little bit, you actually have more awareness. I'm not thinking I don't know whether it can fully cure it, but they definitely notice also meditation too because
Hmm.
again I didn't know then because we are working on, let's say, childhood trauma and other things, but also from the feedback, they come back and they say, yeah, actually, I'm more aware of the ADHD I have. I can recognize that moment, and then meditation help me to actually witness my thoughts, right? First, like
Hmm.
thoughts run the machine, but now you see this, you witness how the thoughts run you, right? So those
Right.
are the things that with like a sound healing meditation definitely helps from if for the holistic way wise, but other ones we are working on belief system, in a different way, but those two I probably add on. But here today, we definitely more focus on the academic one parts of that, right? Uh, is there anything you want to add on before we move on to the depression? Because I think that's a large population, especially now. I mean,
Hmm.
again, like we talked about last time, is like because now people get diagnosed more, and then so the case is also more. But I think probably depression is a I do feel depression is actually has a lot of this how to say that what's going on in the world, fast moving society.
Hmm.
There's a lot of like who I want to be, like externally, like what who I am externally, and versus who I want to be internally. That's what I went through. I didn't know I was have this depression. I actually didn't even know what it was because 15 years ago, 20 years, when you talk about depression, a lot of people don't even know what's the
Right.
depression mean. Now people can openly talk about, I have certain level of the depression, and also seasonal
Right.
depression, right? Yeah.
So the thing with depression too is there is a correlation um to where you undiagnosed ADHD, and specifically people who are really struggling with their ADHD and don't realize it,
Mm,
also can be diagnosed then with depression and anxiety. So you have a lot of that comorbid diagnosis that we call it, to where there are multiple diagnoses going on at one time. But as we know, with ADHD being something that you basically have from birth,
mm,
obviously it was the ADHD that could have caused the
yeah.
anxiety and depression. Sometimes that's not the case. Sometimes people with ADHD get depression and anxiety just like everybody else. But some of the time it can be because they are so overwhelmed with their symptoms of ADHD
Mm.
that they end up also having symptoms of anxiety and depression. And that's when they end up getting their ADHD diagnosis.
Wow, that's interesting. I never thought about that. But when you're talking about that, I think I in my mind there's one person. I'm not gonna say his name because it's publicly, but actually makes sense
Yeah.
because this person has ADHD, but you also can realize the anxiety level is fairly high. I don't know about the depression, but when you talk about, stress, anxiety, that's definitely because they have so many things going on, right?
Mm-hmm.
I feel like there's energy is you never have a time you feel like the energy is all coming down. No, they're always kind of like
Right.
shooting everywhere, even though they are sleeping or even they are sitting there, they're still shooting everywhere, right?
Mm-hmm.
Makes sense. Okay.
And with depression, like there are so many people, and that's one of the things that I try to suggest to my clients too, especially my couples. When I have couples that I've been working with for a while and they have rough patches, like after we already had worked on a lot of things, I'm like, what have y'all been doing on the weekends? And they're like, oh, we've been doing this, 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 and this, and this, this, and this, and this, and this. And I'm like, you gotta slow down. Like you got to have time to rest, you have to have time to communicate.
Mm,
um but it's the same thing with us, with people individually. We have to have time for our body to be able to communicate with us. So if you are going and going and going and going, how do you have time to rest? How do you have time to relax? You're putting all of this pressure on you, and then not resting, not doing anything to help make things better. So a lot of times when I'm working with people with depression, I always start with the basics.
hmm.
So some people obviously come to me on medication, some people come to me not on medication. But either way, I always try to start with the basics. Like, what are your coping skills? What is your sleep like? What are your eating habits like? Are you drinking caffeine after 2, 3 o'clock? Like, what is keeping you, because a lot of times people with depression also have trouble sleeping.
Mm,
So, or they sleep too much. So what is it that is making, what is your daily routine and what also is your hygiene. That's one of the biggest signs of depression.
Mm-hmm.
So I think I mentioned this last time. If you
Yeah.
have a friend who normally does not have odor and then you smell a body odor kind of consistently, it's kind of like, hey, are you doing okay? Like maybe the way to necessarily approach it probably isn't to say, hey, I'm noticing this odor, but maybe just like asking them if they're okay first.
Yes.
Because
Yeah.
like sometimes, especially as adults, even my patients who struggle with pretty severe depression, they know they haven't showered. They just can't do it.
Mm-hmm.
And a lot of times some of the most like harmful things that um I see people reacting to. So clients saying, "Oh, well, I've had this person say to me," or other people I know saying, "Oh, well, this provider told me this." One of the things that I hear all the time that is almost all the time hurtful. Like I never hear anybody say like, "Oh, this was so helpful when somebody told me this." But like just telling them to just do it. Like,
Mm-hmm.
well, just shower. Like you physically can shower, just go shower. And it's like it's not that easy for somebody who's
Yeah.
struggling with depression. And also like you're just making them put themselves down even more for not going to
Yeah.
shower.
Not being able to, right? Yeah.
Right, because
Mm-hmm.
they can just do it.
Mm-hmm.
Like, yes, physically they may be able to walk to the shower, but that doesn't mean that they're able to fully like
Complete that
complete that
mission.
task.
It's a
Right.
mission for them that time. Yes.
Right.
Yes. Mm-hmm.
And I think so there's also the difference between like clinical depression and depressed mood.
Yeah.
And I think we touched on this a little bit last time where you everybody kind of probably has had a depressed mood at some point in their life, whether it was a breakup or the passing of a loved one or just a really tough time in life. You may have a depressed mood, but to have clinical depression, it has to persist. It has to be going on for a longer period of time to actually be diagnosed. I think now the guideline, I think, don't quote me, but I
Mm-mm.
think it's 3 to 4 weeks. And so
Mm.
the reason it used to be much longer, it used to be you had to go like 3 months, but now they're finding that if we treat it faster, then people are having better outcomes, which we
Yeah.
already knew, right? Like
Yeah.
we could have said that, but now they're actually implementing it into evidence-based research and into our diagnostic manual of like we need to treat this faster, so we need them people to be able to get this diagnosis faster.
I have a
Um,
question when you were talking about
Go
this.
ahead.
This is I never ask anybody, and I don't even think that it would be, I don't know. Like, but let me form my question. So when you're talking about this, being clinically depression versus depressed mood, right? Now, when I'm looking back my journey, I mean, I do everything, hygiene, everything. It's more of internally depressed or like that's the depression I'm talking about. Maybe I have depressed mood because just certain things that you should feel happy, but internally I don't feel happy. When everybody think you should be this way, I totally opposite way. And when people don't understand what you're going through, it'll add more onto it. So my question is there a possible because we always talk about mental, physically, mental, emotional, and spiritually, right? So what if I am spiritually depressed or emotionally depressed, but my
Mhm.
physically, of course, because we have feeling, right? I mean,
Right.
my physically still I can finish. I cook, right? I take kids out. I travel. Drive whatever. I can do anything and everything of that. So I don't think of my physically, but what if it's my emotionally, mentally, spiritually? I don't know, like which level, which category would it be? Because obviously I'm not this person that 3, 4 weeks or couldn't get out of my bed. no, I do all of that. So I'm not clinically depression, right? Like that. I'm not that. I was not that. So
Maybe.
what are your thoughts on? I just like, I was just when you think about, because ADHD, I cannot use my own example, but depression
Right.
or depressed mood, thanks for clarify that. I was like, so where I was reside, that was 7 years ago now.
Right.
Yeah.
So the DSM lays out the criteria as first having depressed mood and loss of interest or pleasure. So that's
Mm,
the first two main symptoms. Those
okay.
two must be present. And then there are an additional number of symptoms, and at least five of those must be present. So
Mm,
significant weight loss or weight gain, insomnia or hypersomnia, psychomotor agitation or like slowing of psychomotor skills. So just moving really slow, really sluggish, like physically,
mm-hmm,
fatigue or loss of energy, feeling worthless or excessive or inappropriate guilt, like just feeling like you're not good enough. All of that would
mm-hmm.
fall under that category.
Yeah.
Diminished ability to think or concentrate, reoccurrent thoughts of death or suicidal ideation, those sort of things as well. One of the bigger things that is in every diagnosis, and well, I say every, I would say, I think it's every diagnosis in the DSM, is an additional clarification that says it has to be affecting your work life, social life, or school life, or personal life in
Mm-hmm,
some major way.
mm-hmm,
So if you are going through a breakup, but you're still doing all of your work, doing all of your like housework, taking care of yourself personally, still doing all your hygiene, all of that stuff, but you're sad and you're kind of in a depressed mood and you're not really interested in doing much because, again, you just had a breakup, that doesn't mean that you're clinically depressed.
mm-hmm,
It could be that you're just depressed mood.
mm-hmm.
So it has to have some effect on
Yeah.
your work
Yeah.
and your life. And so ultimately, like spiritual depression could fall into also clinical depression because sometimes you can get so spiritually depressed that you meet these symptoms. But also, like, same thing for, you know, physically depressed, like all of these other things, like you can still meet those symptoms even if it's not like I'm just completely hopeless. Like, even if you have a little bit of hope, like, that doesn't mean that you're not clinically depressed. So there is like a
Mm,
line.
yeah.
Um, and we also have like scales that we use to help like diagnose the things too, so that it's not just um as specific.
Yeah.
Yeah.
Well, from what you said, thanks for explaining that, like what are the two most present and, some are there. So when I'm looking back, that, one or two, and plus the back there, let's say, I had is just like a random, not random, but it's sometimes what's the meaning of my life, right? I should just
Mm-hmm.
go, don't feel good enough. So that's a lot of like mental, emotional there. So I can see other things. I'm like, I'm perfectly fine. So I probably have two, one, two, and then there's another two back there. Like if you're looking back now, I recall like if I need to fall some category because now I'm like
Right.
self-diagnosed after 7 years later, which is fun.
Right.
Which is, I mean, I'm glad that you can talk about it.
Yeah. And that's like also like anybody can self-diagnose and anybody can, look up the symptoms. Like, you
Hmm.
can look up the diagnostic criteria online and it will pull it up. But
Hmm.
ultimately, if you are feeling all of like really depressed and you're feeling all of these things, try to get some help if that is
Yeah.
something that it is you're able to do. And same thing with anxiety. Like you don't have to deal with all of it on your own. Like not even saying that you have like people everybody should be on medication, but just like talk to somebody because if you're struggling with these things, like you don't have to do it by yourself.
Yeah, definitely. So when, it's very interesting, like to see how you guys, put it everything, very clear so people can see whether they have or not. But when we talk about holistic, treatment, again, with working with people, a lot of time my question I'm gonna ask them is like, what are something is really like bothering you? Like what happened? Because sometimes they have a moment of turning point. I was like, from when you started feeling this way, and
Mm-hmm.
usually you can find out this either they are build up certain things or they're traumatic
Mm-hmm.
things, something happened, and then we start from there because part of, let's say, mentally, physically, emotional, spiritually, they're part of themselves are not moving forward with the other parts. Then if I
Right.
can identify, find that one, we want to see what caused it and how that version of you feeling it. So when you can, some therapists is you use talking, right? But with energy work is we would go like revisit that version of you who had this
Mm-hmm.
certain things, traumatic things happen or what caused it. Some could be very deep. They might be build up and they have the tipping point. And if we can find
Mm-hmm.
out that, we usually can use holistic way. Let's say breath work. A lot of time, people don't feel. Let's say if you feel not good enough, you feel you're being judged. If you feel that you have certain anger, you're not allowed to do that, whatever that is. So breath work could help. Sound could help, and other things could help. But it's kind of like very different approach. I feel like when you do holistic healing, a lot of time you focus on through their people's emotional thread to pull out what is
Mm-hmm.
underneath the feelings. We always talk about feelings, how you feel about it, like
Right.
what made you feel. When this thing happened, how make you feel. So I think we good to move on. Is there anything you want to add on before? I think we're gonna move on the panic attack, anxiety, panic attack. They probably,
Right.
they all coming together.
Right.
Yeah.
Um, I think that there is some some therapeutic modalities, like we said before, that also use that same thought process. But overall, like you said, I think getting to the cause is one of the best things that can be helpful for most people because
Mm.
they need some like answers provide a sense of comfort.
Yeah, the story. Like
Um,
what kind of story you are telling yourself, or what story you are living in, and why you believe that's the story. So can we
right.
rewrite that story, right? And so if you
Yeah.
have different belief system, if do not feel that specific words was judging you, then you will not have being judged, and then you will release that part of you. So yeah,
And that's the same thing with anxiety as well. Like if
yes, for sure.
trying to rewrite that story, we call it like narrative therapy. Like so
Mm,
trying to rewrite your story.
yeah.
Um I think the we were talking earlier about the fast pace of just the world that we live in, and I think anxiety adds to that for
Oh
sure
yeah, definitely.
because you catch yourself being anxious trying to get out of the house. You catch yourself being anxious and rushed and just your heart racing and all of these things just trying to do life sometimes because you're just in everybody is always in such a hurry.
Yeah,
And
you need to
so,
achieve more. You need to be almost constant perform, and people
mhm,
always watching you. Not watching you, not in a bad way. It's just like people expecting things from you, right? Like a lot of time, like
yeah,
this morning when again, I got home a bit late, and then when I was, drying my hair, doing a little bit of makeup, and my mind is already, hey, you're supposed to be typing out an email right now, and then my
yeah,
body is only can do this fast, and I'm still here. And when
right,
I catch myself, I'm like, okay, Gina, deep breath. Let's take
mhm,
it one thing at a time. So it's
right,
kind of definitely catch people pretty easy. With this anxiety, like how society wants things move this fast.
right.
Produce a lot of things. Yeah.
And anxiety can create those racing thoughts that almost mimic some of that thought processes that ADHD has. And so it can be
Mm,
really difficult to like diagnose or pick out, especially when looking at those three, like ADHD, depression, and anxiety.
yeah.
Sometimes the symptoms overlap very like broadly. So that's one of the things like I always suggest to people, if you do a self-scoring test online or like something like that, or like you have your research, and so you look up like evidence-based scales that you can score yourself online, just be mindful that just because you score high on depression, like don't make yourself feel depressed if you're not depressed. Like
Mm,
you could score high on that rating scale for depression and it not be depression, it could be anxiety. So it's
yeah.
more so that's where as professionals we have to go through the scale and look at the answers. So a lot of times I don't like to um depending on the person, give the scales ahead of time with the scoring guide, because then people are like, oh, well, now I have depression. And it's like, wait, but let's look at like which ones you answered, because a lot of these questions are related to ADHD and a lot of
Mm-hmm.
these questions are related to anxiety. If you only related, like scored highly on those, then we're not going to say you have depression.
Yeah.
Like it's not an automatic diagnosis. And so I think that is kind of use your best judgment. Like if you know you don't have depressed mood, but you score high on these self-scoring tests, it's probably something else.
Mm. Yeah, that's a good self-check-in, right?
Right.
Instead of take a literally of what that dig in, like which part of the question the answer, like you said, look at the answer. They might be
Mm-hmm.
ADHD. And you're right, because when you have anxiety, those thoughts, they're just like, fung, 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 fung. They're just like,
Mm-hmm.
wow. Like, and then when you turn around, something funny is like, okay, I need to do this, and turn around, I forget everything. I was like, what am I was thinking
Yeah.
about? So I don't know. So can people later develop ADHD? Oh no,
Uh,
because you
I
say it's
don't
born with
I
it,
don't really think so. Like
maybe
as
anxiety.
as far as research like shows, it's something that it's how your brain is formed. So it's not really something that you could,
Later
I
change
guess,
it, right? Yeah.
yeah, unless like I guess maybe like a traumatic brain injury or maybe something
Mm,
like that could cause that, maybe. But
yeah.
ultimately, it's more so just something that happens in childhood, but some people aren't diagnosed until adulthood.
Yeah. Yeah.
And then with anxiety, you can develop anxiety anytime in your life. And
You're
also,
right.
like, so there's the so the anxiety disorder in the DSM is called generalized anxiety disorder, or GAD.
Mm-hmm.
Whereas all of us have some sort of anxiety anyway, because anxiety is what keeps us motivated. Anxiety is what kind of keeps us going, right?
Yeah.
If you're not anxious about a test, you're not going to study for that test because you're not going to prioritize that test. If you're not anxious about somebody coming to your house and it not being clean, then you're not going to clean your house.
Yeah.
So even though those are very low level anxieties, like one, two, three, things you may not even notice, those are anxieties
Mm-hmm.
that we experience no matter if we actually have generalized anxiety disorder.
Mm-hmm. So let's talk about panic attack. So is a panic attack is when the anxiety reaches to a high level enough that stake is so high. I'm using
Yes.
my own language right here.
Yeah. No, that's pretty much it. Um but sometimes it's not one major event. So that's
Build
also
up, right?
like
Something build up.
misconception there.
Mm-hmm.
Yeah, it could just be multiple little things that build up. And so I think that's a big misconception, because a lot of times people are like, "Oh, well, what caused your panic attack?" And it's like, well, it could be like a number of things. Or there are some people who are like, and who have panic attacks that are like, oh, I know like this is the only thing that caused me to have a panic attack.
Mm-hmm.
Um, Panic attacks are scary.
Oh yeah.
Like,
Let me tell
because
you.
you physically feel like you're like a lot of people related to like dying, having a heart attack, like they can't breathe. They really feel like something is going to be
Gone.
like
Yeah.
gone, like that
Yeah.
they're going to be gone
Yeah.
because they are having all of these physical symptoms.
Yeah. The
And so
sensation.
that's where it
Yes.
intertwines, like, because the mental health and the physical is intertwining in that moment.
Yes.
And
Yes.
it's really invalidating when you go to the hospital and they're like, oh, this is just a panic attack, go home. And then people are like, they just told me to go home and I felt like I was dying.
Yeah, I mean the
And so,
thing is that when the panic attack, this thing is like I remember I had it right in June or whatever thing, and I think that was not this June. This was 2 years ago. So I didn't go
uh-huh,
to see doctor because then I was wondering, okay, I need to do some blood check, just blood work, just to see whether
right.
I'm okay. When hospital, everything come back more than normal, just like just
Yeah.
normal as I always be. And I start to describe to this doctor who's there. Um, he gave me, I don't even know what he gave me. I took it one time. First time I took a whole pill of that, and I really it just knocked me out. It's super sleepy, and I'm
Probably like a
like,
Xanax.
because I don't take Xanax or anything. But the thing is, I
Yeah.
don't really take any those things, so I don't know. So
Right.
it was the first time I took the whole one. It will literally like disabled me of even being speaking and moving
Mm-hmm.
around. I'm glad I was
Yeah.
laying on a couch. Did that. Second time I took half because and then I only took 2 times because later I just I think the pace of my life because it was super tight. Things happen, but then it's
Mm-hmm.
help. It took me a good 2 years to rewire just my nerve system because a lot of time it's false alarm. So such as if I didn't get enough food or too hungry or didn't drink enough water or have longer meetings. So my oxygen level, blood sugar level, everything just they all adding onto it. So I don't know which exactly when is the tipping point, but I like, okay, this is too tired right now. Let me take a break. Let me eat some food. Let me
Mm-hmm.
drink some water. Let me take a nap. So I catch myself how close I'll be. I was like, now I know where I fell in the off the cliff. You will not let your body go there again, right? But it was
Right.
so scary, and I felt like I was dying in the middle of the night. I had to call my girl's father. Came to midnight. I was like, "Can you sleep on the couch?" Because I'm so afraid that I'm gonna go on. And the girls, they are so young. I don't even know they will. They don't even know what to do if something happened to me. That was
Right.
what was going on in my mind. I'm like, how what I'm saying? Like that moment, you literally
Yeah.
don't know when was your like a real accident point. And I'm like, I'm not afraid of dying, but the thing is, it's not my time. I'm not done yet. I cannot go.
Right.
It was
Yeah.
crazy. Yeah.
And so then after you have like your first panic attack, then anytime you experience similar symptoms, you then worry that you're having another panic attack. And
Yes.
so a lot of times people, even if they never felt that anxiety, so obviously like we've talked a lot about self-awareness,
Yeah.
if they've never felt that anxiety and then they have a panic attack, and so because that's how a lot of people learn they have anxiety is they have a panic attack, they go to their doctor, primary care, hospital, whatever, and they're like, "Oh, you had a panic attack." And they're like, "Oh, well, like what causes that?" And they like find out it's anxiety and like all of
Yeah.
the things. And they're like, "Oh, like I've been feeling that way for months. Like I didn't know that that was anxiety." And so then your anxiety continues to get worse because now you're worried that you're going to have another panic attack. So a lot of times when I work with people who have panic attacks, we have to work through that fear of like having another panic attack.
Yeah. Yeah. Yeah.
So there are a lot of obviously like mindfulness, meditation, doing things that help them to breathe and bring things back in. A lot of the things that we also work on is just like lowering that overall anxiety level. So
Mm,
if your base level of anxiety day to day is like a 5, then it does not take you long to get to panic attack level. If a
mm-hmm.
panic attack level is like 8, 9, 10.
Yeah.
And so trying to lower that to like a 2 or 3 so that if a big stressor comes, you're just right there at like
Yeah.
increased anxiety, not panic attack level.
Yeah, yes, that's so true because I also remember that, like, the June one or May June was the first time. Then I
Mm-hmm.
think later I had two or three, probably minor one is actually one time, no, two time I was driving. So I developed the fear of driving long distance because if I don't know how my energy level goes, and if I
Right.
drive, let's say an hour and a half, actually I had an episode I had to pull over. One time I had pull
Wow.
over for 15 minutes and I drive again. As the other time I actually had somebody to later that was say I will not be able to drive because when I see the car, boom, 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 I was like, no way. Like I feel like either I'm gonna go crash or somebody gonna hit
Yeah.
me. So I had to pull over and I waited probably 30, 40 minutes for my girl's father with another car so he could drive my car back home. And then once I got home, I lay on the couch, I was fine. But like
Right.
that moment, because I can sense because my body started to get tingling, my hands and my legs
Mm-hmm.
start tingling, they get a little bit solid. I'm like, okay, this is this is coming.
Mm-hmm.
And I'm like, okay, it was scary. Sometimes I even think about that and make me, feel nervous about it. I was like, okay, I don't want that because my body doesn't like it, my mind doesn't like it, nothing I like it. But yes, if you have absolute driving, it's really scary. And I learned the breathing of like inhale 4 times, hold 4 times, exhale 4 times. Does help because a lot of time
Mm-hmm.
we are not breathing because we are so stressed, anxious
Yep.
about certain things, not breathing. So, but also that very similar to our breath work because when we do breath work, when you have hyper oxygenated, you also have tinkling. So sometimes it's like, oh my goodness, am I hyper oxygenated or I don't have enough oxygen? So it's kind of a dance, but that's was, scare me a lot of time. I had quite a while not so sure about driving long distance. I really need to kind of make my mind of, okay, this is how I'm gonna get there, and then take break or something like that. And if I don't feel comfortable, I will have to just exit or something like that. But it's kind of like nerve wracking, definitely. I mean, for among all the things that I went through in life, I think a panic attack is the least things you thought would be make you so afraid of that is panic attack. Like,
Yeah.
you know, we don't have a couple minutes, we don't have many much time, but let's talk about PTSD, okay? Because I think this is another one that are very majorly,
Mm-hmm.
will you walk us through a little bit about the PTSD and how, we work with PTSD person, things like that. Yeah.
So I think one of the biggest things with PTSD is like just diagnosis in general, because getting that diagnosis for some people it's a big shock. Other people it's um kind of expected. Like some people just cope better with the diagnosis itself, but also other some people are just like, oh, well, that wasn't very traumatic, even though it was something that was traumatic for them once
Yeah.
we get into the work. So a lot of times, sometimes I see clients who I'm working with them for a few months before we actually start realizing that what they think was generalized anxiety is actually PTSD. Um, in some of the previous diagnostic manuals, PTSD was actually listed as an anxiety disorder.
Hmm.
In this most recent uh, version, they separated it into its own category of like trauma disorders. And so now it's separated, but like a lot of your symptoms that you experience in PTSD are similar to that of anxiety, especially like anxiety and panic attacks.
Mm-hmm.
So a lot of times people come in and they think like, oh, I'm just having anxiety. But once we get down into the deeper cause, kind of like what you were talking about earlier, getting down to that root cause we actually find that there's some sort of trauma that has caused the
Triggered.
long-term effect.
Mm-hmm. So is
Uh,
that why the veterans
mhm,
have more of the, I mean, no more, like, a lot of vets came back, I think because they not suffer, like they had
mhm.
this trauma in the war or something like that when they reintegrated with society, right? Like I feel like that's the clients or like this group of population more tend to have more of diagnosed with PTSD. Is that fair to say?
I would say the majority of that's probably at some time have struggled with either what we call like an adjustment disorder, which
Mm,
is like the step before PTSD,
yeah.
or PTSD.
Mm,
And but now we're seeing so many other classifications of people that are having these symptoms. Even kids who are experiencing PTSD symptoms and trauma related symptoms that originally, like, PTSD was just a something for veterans, something for
mm-hmm.
military personnel, but now we're definitely seeing it in kids, adults, uh, all different all different jobs and occupations.
Yeah, when you talk about that, something pop up like, let's say if the child, right, let's say they're 3 years old, they l- left by parents somewhere accidentally, went through
Mm-hmm.
their trauma, right? Then if for whatever reason you didn't take care, do counseling, whatever, right away, this child might develop anytime the parents leave, go somewhere, will trigger that
Mm-hmm.
thing. And then a lot of time people will think oversensitive, like, okay, you are whatever years older now, why da 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 da. And I think that's something that deeper than that. It's because there are unresolved, trauma there. But we are not even talking about past life trauma. Certain
Yeah,
people, the trauma is not just this lifetime. They cannot explain that.
right.
It's in us deep in their subconscious. Then where that, like, that's might be their parents. They inherited their trauma. So that
Mm-hmm.
I feel like the PTSD, even all of that, they like we talk about, they're not just something happened in their life. They might be past life or ancestor, or they might watch other people. You talk about that, like you
Yep.
second trauma, right? So I do see, there might be this child might have a combination of all the things,
Right.
anxiety, right? Stress, anxiety, and a
Yeah.
PTSD,
And
yeah.
now we're seeing even more research now of fetal trauma and how that's affecting even babies in the womb, and
Oh,
how,
definitely. 100%
yeah,
I
like
believe that.
they're still experiencing that. And so that then goes into something else of like postpartum, like then that mom guilt is even worse because it's like now my baby has experienced all of this trauma. And I think like when we look at trauma, we think about it as like some overarching event that just is so awful and like gore and very bad. I mean, not saying that trauma isn't bad, but we
Traumatic.
paint it as this picture of very dramatic, very like
Hmm.
Hollywood style,
Yeah, yeah, yeah.
right? Whereas in reality, like it doesn't have to be that. And most people have experienced traumatic events, even if it is not PTSD. So I think there is a lot of guilt in society of like, well, I put this person through this, like
Mm,
I put them through this traumatic event, but it's like they've probably already been through traumatic events. Like not
yeah,
to like don't carry that guilt because some of it's not in our control, right?
yeah, yeah,
Like accidents, like medical trauma, like so a lot of things just are not inside of our control, but
yeah.
they still are traumatic events.
Yeah, and I feel like there's a lot of healing in those things too. Just like you said, sometimes, or especially parents, right?
Mm-hmm.
With kids, like parents carry a lot of guilt. If I didn't do this, then that's not gonna happen. But what if when you talk about when we talk about spiritually, like if you and me don't have a previous agreement, why would you think in the 8 billion people, you and me having this conversation here? But we are just talking about those good conversations. But when we talk about those dramatic life lessons, there if you want to learn something, there's a teacher and a student. They have to be in a classroom. You know what I'm saying? So it's kind of like when you allow you to see things in a different way of like, things it happened, but what do we learn from here? Right? How
Hmm.
can you see ask questions? Like it's easy, so easy for me to say right now, but it's actually when you at that moment it's so hard because our body is going through process those emotions, traumas, especially when a
Yep.
society is not, we never thought about doing that. So first of all, the physically have to wait navigating through, then our emotion kind of makes sense, right? Mentally try to understand, and then spiritually, oh, aha moments also, oh, now I understand why I need to went through with this trauma because I was healing from that or learning from that or integrate from that, depends on how you see it. So I think that's why a lot of things like childhood, they will, when you are 7 8 years old, they still going through their physical, mentally, emotionally, and later it has a spiritual, alignment of, oh, now I understand, especially in the healing community or, with your clients, probably in different cases. But when I interview people, especially for people who have traumatic childhood or traumatic, whatever, 20s, 30s, and then almost near death experience to now they're doing the beautiful work. But I asked them that, okay, if you could go back, like talk to little Kesley, what do you say? She's like, well, even though I'm looking back right now, certain things I might could make different choices, but when I look at the whole, I don't want to change a thing, right?
Hmm.
So it's kind of like, you know, those things, I think everything happened for a reason, but certain things we are learning how to um, balance things, right?
Yeah.
Because nothing is bad. Because if you have anxiety, it shows that you worry about certain things could go wrong. So let's talk about when was this thing go wrong? How does that make you feel? And then maybe you will not need to going through the similar situation make you feel will happen that certain way, right? So they all
Right.
remind us there are certain things that we can have some healing to be done and integrate to be better understand ourselves, right? Yeah.
Yeah, for sure.
Yes. So I'm gonna wrap up here. Do you have any parting message and also how people can find you and work with you? And then I think we are wrap up beautifully.
Yeah, so I am on, like, my website is denny-counseling.com. So it's DENNEY counseling.com. I can only work with people in Tennessee as of right now, but I am working on some other states for licensure. So
Yeah.
that's new and interesting. But also, even if you are in a different state, I am willing to help, like, you find resources and find help.
Yeah.
Um, and also just reach out and, like, don't feel like you're alone in this situation, because there are so many people who have experienced these things, which is why we can learn about them and talk about them, is because other people have been through them.
Yes.
Um, and so just reach out if you need it.
Yeah. Well, thank you so much for, come with me for another episode. And I feel like I learned so much on the this academic, it's a different
Mhm.
type, how you guys diagnose. It's
Yeah.
actually helped me understand so much. And I was okay. It allowed me to actually understand deeper than when I use holistic healing modality. Now I understand what people going through better, right? So thank you so much. And if you guys have any questions, feel free to like reach out to Kesley. I
Hmm.
always put their contact information there. But if you have any suggestion or question, or if you want to have Kesley to back to talk about certain things we didn't touch on because we only can think about what we think is useful for the public, right? Feel free to write me an email, innersensoryhealing at gmail.com, or you need it through diversity01 at gmail.com. And I will see you guys next week. And thank you, Kesley. Thank you so much.
Thank you so much for having me.